Hello, welcome to Plastic Surgery 90210. Hi, Dr. Katzen.
Hello, how are you?
Great. So we're here with our amazing patient, Amanda. And Amanda's just going to share with us her weight loss journey. We're going to ask her some questions. You did the whole body lift, basically.
Yes, I did.
Lower body, upper body, and some things in between. So first, why don't you introduce yourself to us?
Well, I'm Amanda Whittington, as Ariel was saying, and I'm about 2 years out from vertical gastric sleeve weight loss surgery. I had basically struggled with my weight my entire life, but it got especially bad when my husband and I were struggling with infertility. We went through so many treatments, and of course, all those hormones and stress can cause a lot of weight gain. So after we decided we were finished building our family, which thankfully we have one healthy little boy, just turned 8, I decided I was ready to lose the weight for good. So I approached my doctor. I asked if I was a candidate for weight loss surgery, and they sent me to UCLA. Dr. Chen, fantastic doctor, fantastic program. I jumped through all the hoops and I got selected, and I'm a success story now. So I've officially lost 165 pounds, but with that came a lot of loose skin. It was horrible to try and stay clean, to try and dress with all that loose skin. So once my weight loss had stabilized, I decided I was ready to approach Dr. Katzen.
Amazing. And so that's like the brief rundown. Can you tell us what your heaviest weight was and what your current weight is?
My highest weight was 304 pounds and my lowest was 139. Right now I maintain between 146 and 148.
Awesome. A very healthy weight.
Yes.
Yeah. When you hit those 300s, was it kind of shocking for you?
It was very depressing because, as I said, I struggled with my weight my whole life, and in my early 20s I actually succeeded in losing 100 pounds the hard way, diet and exercise. It wasn't exactly the healthiest. I was starving myself and over exercising. So it doesn't surprise me that throughout life and throughout all these challenges, I gained all that weight back and then some.
I just know that for a lot of people, when they hit a different number that they're not used to seeing on the scale, it's like, sometimes it's a wake-up call, sometimes it throws them more into depression. You know?
The biggest wake-up call actually for me when I hit that 300, not only was I was in so much pain I could hardly walk. I was almost wheelchair bound. I actually have an electric wheelchair at home that thankfully hasn't been touched in several years.
Cool.
But then my dad suffered a double pulmonary embolism. He's always been heavy set, both my parents are, and we nearly lost him. He was in the ICU for almost a week. We weren't sure he was going to come out. They gave him something like a 25% chance of making it, but he pulled through. And seeing him go through that, I realized that I was on the road to a very early death, because now we know both sides of my family have all these risk factors for blood clots. So I was like, I need to do something about this, something permanent.
Wow. That's so sad, but I'm so glad he's okay.
Yes, thank God. And after watching my transformation, he actually approached his doctor and went on a prescription diet, and he dropped 80 pounds. So he's doing a lot better. My mom, too, she is about 6 months out from her own gastric bypass surgery, and so far she's lost 56 pounds and dropping.
That's awesome.
Yeah.
That's awesome.
That's great. And Dr. Katzen, is this a common story that you hear where people and their parents, you know, they find out, oh no, I'm on this very unhealthy path, this could be me?
Yeah, it's very common. Obesity, I think, runs in families, statistically proven, and it's very common for these situations to exist. I'm always interested in sort of what is the wake-up call, or what sort of notifies the individual, I got to lose the weight.
Exactly.
You know, usually it's not a gradual buildup. Usually it's a defining one episode. Maybe it's a family vacation. You couldn't get on the bus was one story. Here's a story of a almost fatal double pulmonary embolus. You know, we hear these, you know, incidents. These, you can put your finger on the exact time where you're like, I got to lose some weight.
Exactly.
And so I find that very interesting for my patients. Yeah.
Especially for my little boy, who thankfully my husband and my son are very healthy weights, and I realized I want to be a good example for my son. I want him to grow up and continue to be healthy and not deal with all the things that I dealt with growing up, all the really hard bullying moments that you run into when you're a bigger kid.
Yeah.
So you got the gastric bypass surgery?
No, I got the vertical gastric sleeve.
Okay, you got the vertical gastric sleeve. Can
Yep.
you tell us how that recovery was for you and your lifestyle changes that came with that?
It was easy, actually. I'm sorry. I know a lot of people want to hear, no, it was so hard to give up the food. And it was, but honestly, I had gone through so many years of therapies and working on the emotional side of the reason I was so big, that by the time I had reached the end of my surgery, I was ready. Also, another interesting thing was it was right after I had had COVID and losing my ability to smell and taste. I realized that what I was doing with food was I was seeking comfort. I was going to food for these emotional things that once I couldn't smell or taste them, I couldn't do that anymore. And I realized that my relationship with food was so unhealthy. So then when I got the sleeve, I felt blessedly full for the first time, I think, in my entire life. I was able to eat and not still be hungry. And so the initial recovery, of course, was pretty intense because I was up and walking every 3 hours in the hospital, which, again, UCLA, fantastic hospital. I loved my experience there. But then the weight just sort of melted off, and I'd always been really kind of athletic, and I loved swimming and running and all kinds of sports as a kid, and I kind of got back into that, and I took up running, and like I said, the weight just kind of fell off after that. But you got to be ready. My mother's experience is, I think, a little more typical. She still struggles with that emotional eating. She's not losing the weight as quickly. She's postmenopausal, of course, so that also plays a factor. But I know that my case is probably not typical, but I found the process rather easy.
People do say that they need so much mental training or therapy prior to going in, because if not, it's so easy to just slip back into your old habits.
Yeah, I would definitely say the process is 90% mental.
And Dr. Katzen, with your patients who have bariatric surgery, what would you say their experience tends to be?
Very similar. I think patients go through just years of this torment, if you will, with food, not knowing how to manage it and not knowing how to deal with the weight gain and weight loss, and years of yo-yoing up and down. So the surgery provides a very good treatment and almost cure for obesity. Okay, not necessarily a cure for a lot of the food addiction behaviors, if you will, but it does provide a mechanical way to minimize gaining weight.
Right.
All right. So it is a very effective tool, but again, you can fight the tool and you can gain the weight if you don't go by the restrictions. So it's not a guaranteed thing. It's just here's a tool. It can help you lose weight. Here are the rules. Follow the rules, you will lose the weight.
Yeah,
the majority of the time.
Even 2 years out, I'm still following a very strict diet. I track all of my proteins and my macros. I eat every 2 hours, well, not around the clock, but between 8 a.m. and 8 p.m. I eat every 2 hours. I have to keep that schedule, or else I slip and I might overeat something, or I might eat something I'm not supposed to and make myself sick. So it's a continuing process.
Yeah.
And it will be that way my whole life.
Yeah, so it's I mean, it's a tool, and we just give you the instructions to keep the weight off, and if you follow those, it'll work.
Exactly.
It should work 99% of the time. So I think it's a very, very effective tool. These surgical procedures, the sleeve is a great procedure. We had the gastric bypass before that, the lap bands, gastric surgeries, gastrectomies before that. So it's an evolution of these surgical procedures, but I think the sleeve is a very good procedure.
Yeah, and it worked for me.
Yep.
Yeah, you're the perfect example of how to do it, how to maintain it.
Thank you.
And for people that don't have an idea of like how much you can eat or what you can eat, can you give us an idea of what your day in the life of eating looks like?
Well, of course, in the beginning, I could hardly get an ounce of food down, or I was living mostly on protein shakes. These days, I average about 4 ounces of food. I measure by volume on a scale for every meal. 4 ounces of food per meal, and then I have 3 snacks scattered throughout, which are usually about an ounce, maybe an ounce and a half. So on an average day, I hit between 1,200 and 1,400 calories, and I aim for a minimum of 100 grams of protein. I find that the high protein, low carb diet is what works for my body. Not everybody can do that. My mom can't do that because she's diabetic. She has to have more carbs, but those numbers seem to be the magic key for me. So.
Wow, that's incredible. And for people who don't, if you want to reference, 4 ounces of food isn't very much.
No, it's about the size of the palm.
Right, or like a portion cup at Chipotle, for example.
Exactly, yes.
You know, that's 4 ounces,
yeah,
which is like, that's not easy for someone who's not trained to just eat 4 ounces of food. That's like the meat that you get on the Chipotle bowl. Then you get like at least 10 other ounces in there usually.
Exactly.
So that's a really strict diet.
A bowl at Chipotle lasts me about 4 meals.
That's awesome.
Yeah.
And again, these restrictions, these parameters are for you.
Exactly.
Okay, so they may not work for everybody. They may not work, maybe you had the Roux-en-Y gastric bypass, duodenal switch. It may not work for you and your lifestyle. Maybe you have diabetes and you'll have to have a different lifestyle. Maybe you haven't had any of these gastric procedures, and these kinds of diets may not work optimally for you. So everybody's a little bit different, so this is just what works for you.
Exactly. So. I had to explain, well, I spoke with Ariel earlier about my aunt. I'm now acting as her personal trainer. I used to be a certified personal trainer, and I specialized in nutrition, especially for diabetics, because I got the certification to help my mom.
Oh, sure.
And my aunt was like, well, why can't I just do the same diet and lose all the weight? I was like, well, you can try, but your body's going to fight you every step of the way, because without the surgery, your body's going to continually tell you, I'm still hungry, I'm not full.
Sure.
So
sure. The way I look at it is like it's like a car.
Yes.
Okay, so we are changing the stomach, we're changing the engine, if you will. So you have to change the gasoline. So we're changing the fuel or the food we're feeding the car.
Yep.
So that's the way I look at it.
Yep.
So Amanda, as you started to lose the weight, did you instantly start to see your excess skin appear?
In some areas, yes. I had a ton of extra skin on my arms especially. I kind of had an idea that that was going to happen because, like I mentioned, in my early 20s, I did manage to lose 100 pounds, and that's where I saw it the most. The skin on my arms just never really retracted, so I had pretty bad bat wings, as I like to call them. And then the other place I noticed it a lot was in my chest. It was really hard mentally to deal with the fact that as a woman, my curves were going away. So that was definitely the 2 biggest points that I wanted to deal with when I came to Dr. Katzen.
Let's fast forward to when you decided to get skin removal surgery. Did you have to convince yourself, or did you know that this is what you wanted?
I knew it's what I wanted, but I wanted to make sure that I was ready. I had consulted with my surgeon, Dr. Chen. He advised me to wait until I was 2 years out. However, my weight loss pretty much stopped at 12 months on the dot. So I spoke with him again, and he said, well, so long as you maintain the same weight and you don't go either 10 pounds up or down for a whole 6 months, then you can start the process of skin removal. So that was the timeline that I gave myself, and that was actually the day that I hit that timeline was the day that I came for my consultation. I scheduled my consultation with that day in mind.
Good,
right on the nose. Yeah. Okay.
Yeah, you follow instructions perfectly.
Exactly. Well, that's the other thing I tell people is, like, they ask, how did you do it? Well, I just did what the doctor told me to. I followed his directions to a T, and ta-da.
Yeah. And what was that consultation like with Dr. Katzen the first time you met him?
Oh, it was fantastic. He was actually the second plastic surgeon that I consulted with. The first one was, of course, closer to home, but I didn't feel as comfortable with the other doctor, and price was also a factor, but Dr. Katzen's office was able to work out a fantastic price because, of course, insurance didn't cover anything. Anybody who talks to me, wants to ask me questions about my plastic surgery, I say, first off, don't expect insurance to cover any of it. There's certain hoops you have to jump through, and honestly, a lot of the time, the procedure that you get through insurance is not going to hit all those marks that you really care about. For instance, I knew that I wanted to have a tummy tuck, but I also knew that I wanted to have a Mons lift, a muscle repair, a 360 rather than just a tummy tuck. And then I researched plastic surgeons for at least a year, and Dr. Katzen was the only one I found who would do all of those in the same procedure.
Good. Good, good, good. Yeah. So all those components are very important for weight loss patients. Pretty much all those areas get affected by weight gain, weight loss, male or female.
Right.
So you got to fix the muscle. You got to relocate the belly button. You got to lift and reduce the pubic region. Got to get rid of excess skin. Got to get rid of excess fat.
Yep.
So all those go together. And yeah, unfortunately, the insurance companies don't see it that way. The way I see it, you know, the excess skin is a repercussion of a disease. The disease is obesity. Mm-hmm. So technically they should cover it, but they see it as a cosmetic thing.
Right.
So,
I think it should be considered reconstructive.
It is, yeah. It is.
Yeah.
So in plastic surgery world, you've got plastic surgery here, and there's the sort of the aesthetic or the cosmetic component, mm-hmm. and then you've got the reconstructive component. Mm-hmm. So in aesthetic cosmetic plastic surgery, we're taking a normal appearing individual and making them super normal. Okay. In reconstructive procedures, we're taking a person that is abnormal, okay, in quotation marks, and bringing them more normal.
Right.
So the procedures that we do pretty much after massive weight loss are reconstructive plastic surgery procedures.
So hopefully one day that will be recognized and changed by these insurance companies.
Yeah.
Knock on wood.
But until then,
yeah.
I mean, you're giving them perfect advice, and it's to not expect anything to be covered.
Yeah.
And another patient of ours was just on TikTok explaining to people, you know, like, just like you said, insurance could possibly cover something like a paniculectomy, mm-hmm. but then that means you could have to do another surgery in the future to get the aesthetic results you want.
Exactly.
Correct.
So you mostly looked at him on Real Self?
Yes. Yeah.
Okay. And then did you find him on YouTube or Instagram or anything?
It was through Real Self. I eventually went to his webpage, and from there I found the social media, and I think I've watched every video of yours on YouTube. I followed up. I wanted to be really sure that I was going to get the results that I wanted.
Okay, good. Good.
And what did you think of those videos?
I have to admit, the first time I watched a full surgery video, it did freak me out a little bit. That was a lot to take in. But then kind of taking a step back and realizing, yes, this could possibly be me, but I'm watching it for educational purposes and research purposes. I was able to handle it and really appreciate the work you do and the results that you get from your patient from your work for your patients. It's amazing. It was breathtaking.
Cool.
And I really appreciated that you had all that documentation to show exactly what you do, and it spoke to me of a very honest surgeon, somebody who isn't afraid to show his process. Mm-hmm. Mm-hmm. And it also meant a lot that your patients didn't look cookie cutter.
Yeah.
You didn't look like you were just super
making sure everyone is the same. Yeah.
No Barbies and Kens.
Yep.
And you also took patients that a lot of other surgeons probably wouldn't accept. Patients who may still be a higher weight.
Yeah.
Patients who maybe I was just talking about this with Ariel. The fact that you do silicone removal, mm-hmm. and you work with patients who need that reconstruction. You're not just interested in the bottom dollar. That really struck me.
Thank you.
Yeah.
So we do the YouTube videos, Instagram videos for many, many reasons. One is patient education. Mm-hmm. I believe the more educated patient you have, the more they know about everything, and especially their situation and going into their situation. So the more information we can provide, whether before and after pictures, videos during the surgery, explaining things, I think it's very valuable for the patient.
Yes.
And then also the YouTube videos sort of provide proof to you and other patients in the world that, yep, we've done this before. We used to get patients in the office, Dr. Katzen, I've lost 80 pounds and you've never seen a patient like me. I'm like, yeah, I'm sure I have. And they show me, everything. And I'm like, yep, let's go to our website. Here's one, here's another one. And if we can show patients that I've seen that before, it sort of reassures them that, oh yeah, okay, you've seen that before, you've treated it, and this is what I should expect to look like.
Yeah.
So I think that's very valuable for the patient. Yeah.
It also helped me to know exactly how to communicate to you exactly what I was wanting.
True. So then we can go to before and after pictures, and you can go, I want that, or maybe more importantly, I don't want that.
Exactly.
Yeah.
And you eventually allowed us to film both of your surgeries, which thank you so much, because you're just helping add to patient knowledge,
Yes.
you know, and anybody else watching really. And there are tons of comments that say, thank you for sharing your video with us, allowing us to film you.
Yeah.
And what made you decide to allow us to film you?
Well, ultimately, I want to be able to show people just like me, because I remember scrolling through endless videos of plastic surgeries, trying to find somebody who was like me, who had lost the same amount of weight as me, who had dealt with the same issues I had dealt with. And it was really hard to meet all those criteria. So I wanted to be able to put that out there for other girls like me who maybe got up to the 300s, managed to lose all this weight, and now they just want to know what to expect with the next step.
What was it like for you to watch your videos?
Oh, it was trippy. It was very trippy. It was fascinating too. I loved watching, especially my tummy tuck, and seeing how you were able to get those muscles to come together and how you described it, and it kind of being able to feel it under the skin. I was like, oh yeah, now I can understand what's going on.
Does the tummy feel tight now still?
Oh yeah, I still have a lot of tightness. I'm almost 6 months out, but I still feel a lot of tightness here. Still working on being able to do crunches.
But a good tightness.
But a good tightness.
Yeah,
I feel it feels, well, I used to wear corsets quite a bit, so I kind of like that tight, kind of cinched in, snug feeling. It feels kind of comforting. But yeah, I showed my mom my videos. She's a nurse, registered nurse. Okay. So we both thought she could take it, but about halfway through the video, she's like, I can't watch it anymore. They're cutting out my baby. I can't.
So when it's you or somebody else you know, it's a different kind of ball game.
Right. My aunt, however, has watched both of them and commented on both of them, and she was very excited for me, and she's still, I have a really good support system, but my aunt, most of all, is my biggest cheerleader.
Good.
So sweet. Yeah, I remember her comments saying, that's my niece.
Yes.
I was like, geez, I really hope that's really your aunt.
Yeah, that's her.
And have you read all the comments on that video?
I have, yeah.
What do you think? People are like so supportive for the most part, right?
Right. There were a couple where I was like, oh, that's not very nice, but water off a duck's back. But
that's social media. Yeah.
Exactly. It meant so much to me to see all of these comments and the big congratulations and that I deserve it, and it's still, I still have to wrap my head around the fact that I'm this smaller person, because like I said, growing up being big my whole life, I was bullied relentlessly, and it kind of puts this picture in your mind of who you think you are, and makes you kind of feel like you're not worth all that much because of your appearance. And now that that appearance has been taken away, I kind of liken it to a butterfly coming out of its cocoon. Now that I'm a butterfly, I still have that caterpillar in the back of my head. And it takes time for that to come away. And even from strangers hearing she deserves this after all that hard work, that means a lot. That means a lot.
Yeah. And you absolutely do. And the beautiful part too is you needed that caterpillar to become the butterfly, right?
Yeah, exactly. If it weren't for the person I was, being brave enough to move forward with the weight loss surgery, I wouldn't be the person I am now.
That's right. Yeah, you look fantastic.
Thank you.
Fantastic. Has the brain caught up yet, or is getting there?
There are days when I feel like I am in the skin that I'm in. And then other days where I forget. So for instance, if I'm going clothes shopping and I haven't looked at myself in a mirror for a couple of days, I might forget, oh yeah, no, I'm a size small.
Good. So, and hopefully the days that you feel skinnier outweigh the days that you feel bigger.
It's getting there.
Yeah, good.
It's getting there.
Good. Yeah, we've had some patients sometimes years out, and they walk past a mirror and they're like, whoa.
Yeah.
You know, who is that person in the mirror? It takes a while for the brain and the body to sort of reconnect.
Yeah. Throughout my healing process, I actually got in the habit of standing in front of the mirror and just looking at myself for a few minutes and getting used to the fact that this is what you look like now.
Cool.
Yeah.
That's a good form of therapy. That's good.
So a lot of people like to comment, how do they deal with the scars? What is your answer to that?
Well, I consider myself lucky in that I know I scar very well. After my weight loss surgery, my surgeon, Dr. Chen, even commented about 6 weeks out. He's like, you can hardly see them anymore. How do you you're healing so well. And my scars on my arms are lightening up quite a bit. Like I said, I'm about 5 months out. So I know I'm lucky. Not everybody's going to scar as well as I do. But even still, I kind of consider it a badge of honor. Like, I earned these scars. I went through hell to get these scars.
True.
The process was by no means painless. I wouldn't say it was the worst pain in my life, but the mental part of it was definitely harder than the physical. But these scars show that I got through it, that I earned this. And in some areas, the scars are a little darker and more stretched, like on my back, and I'm considering getting tattoos to cover them. But otherwise, scars are just, I would much rather have the scars than the skin.
Yeah, exactly. So it's a trade-off.
Yeah.
Okay, so I have a lot of patients come in, I can't do the scars. And I'm like, well, then you have to live with the extra skin.
Okay.
And the majority, by far majority of my patients are like, oh, I'm so glad I got rid of the skin and traded that for a scar. But it's sort of it's a trade. It's a trade-off.
And I like to say, more people see you with clothes on than without any.
Exactly, yeah.
The people who see you without clothes, they better love your scars.
Exactly.
Because they love you for all of you.
Yep.
But the other day you showed us you in a bikini and you looked amazing.
Yes. I thought I was going to be so self-conscious in the bikini, but I actually felt fantastic. It felt natural to be at the poolside at my neighborhood and wearing my bikini, and it was fantastic. It was great.
Awesome.
Yeah,
That's awesome.
a little dream come true.
Was it a little scary putting the bikini on and going outside?
A little bit. But once I was out there, I felt fine.
Yeah. Good.
And is that something you weren't able to wear before? Or
Absolutely not. I mean, I know they say any body is a bikini body, and I'm sure if I was brave enough, I could have done it, but that just wasn't me. I was very low self-esteem, low confidence when I was the bigger girl. So I applaud those big girls who have that confidence and rock that body, but that was not me.
And what is your advice to the bigger girls and the bigger guys that are struggling with their weight and don't even know where to start?
I would start by approaching your doctor. Approach your primary care physician. Let them know that you're struggling. The first step in taking control isn't just a drug or a surgery. Oftentimes it's therapy. People don't get to be as big as I was without there being something else involved, whether it be a thyroid condition or food addiction or an unhealthy living situation. Some things are harder to fix than others. It's going to be a different journey for everybody, but the first step is, of course, admitting that you need help.
Yeah, it's that first step. Yeah. That first step is the hardest. And as we say, there are 1,000,001 reasons why people overeat, okay? And we just need to, so everybody's different, and we just need to sort of navigate why that is and work it up medically. There are many different angles to that in terms of, medicine or psychiatric issues, stuff like that. But it needs to initiate by that first step on the patient's behalf.
Yeah.
Yeah.
And if someone's considering the bariatric route, what do you recommend for them?
I recommend, again, approaching your doctor, asking to begin the process, because it is a process. I had to do a minimum of 6 months to a year of a prescribed diet first. My doctor permitted me to select my own, so I chose Noom. I had to stick with that diet and lose, I think it was 10% of my body weight before she would even pass my name on to a bariatric program, which was UCLA. After I entered UCLA, they wanted me to lose an additional 10% as well as go on this even stricter diet, to begin exercise on a regular basis. I had to prove to them that I was ready and willing and able to do what they were going to do. Once I had completed that, it took about 9 months total. My insurance finally approved the surgery, and that's when I finally had the weight loss surgery. But you have to prove that you're eligible.
So is that to prove to insurance that you're eligible, or is it
Yes.
to prove that you can get the surgery done?
You're proving it to insurance, you're proving it to the doctor, and honestly, I think you're proving it to yourself.
Yeah, absolutely.
Wow, I never knew about all that.
Mm-hmm.
There are a lot of criteria that you have to pass to get approved for these gastric procedures. And I would also caution too, there are many different gastric procedures, and there are many different surgeons that specialize in certain procedures.
Right.
So there are certain doctors that only do one procedure. There are several doctors that do many different procedures. But if you go to one doctor that only does that procedure, you may go down that path.
Exactly.
So I would tailor your gastric surgery in terms of what is best for the patient.
Right.
Okay,
Yeah.
so one patient may do best on the gastric sleeve. One patient may be doing better on the Roux-en-Y gastric bypass, another on the duodenal switch. They're different surgeries. So go to a program that offers a variety of surgical techniques, and then let the process select you for the best surgery.
I can't agree more,
Yeah.
because when I originally went into this process, I had wanted the Roux-en-Y. I was dead set on getting the Roux-en-Y, but then when I met Dr. Chen, we looked over my medical history and decided that the sleeve was better because of past abdominal surgeries that I'd had. I'd had my gallbladder out, there was scar tissue to consider, so he said, no, I'm going to do the gastric sleeve, and you can either take it or leave it. He's very much, that's very much the type of doctor he is.
Yeah.
But I'm really glad that that was what we chose. And as I mentioned earlier, my mother had the Roux-en-Y because of her history with diabetes. That was what her medical history kind of dictated what was best for her.
Gotcha.
Now, let's go back to your plastic surgery with Dr. Katzen. What advice do you have for people considering skin removal surgery?
Research, 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 research. Don't settle for a doctor who offers a lower price if they don't make you feel like they're the right one. You got to make sure you have the right fit. If a doctor says something that you don't agree with, seek a second opinion, seek a third opinion. Be your own advocate, most of all. I have taken part in a plastic surgery support group for a number of years now, and I can't tell you how many patients walk out of their doctor's office feeling worse than when they walked in, because for any number of reasons. I wish I could say that every plastic surgeon can be trusted, but not every one of them can. So do your research, ask questions. Don't be afraid of the doctor.
That's true, because we have heard stories from our patients where they go to a different surgeon and they want something and they walk out with a completely different list of procedures that they hadn't even thought about before.
Right. Yeah. Right.
Yeah. What about the mental part of it?
Recovering was definitely intense. A lot of people like to say, oh, such and such is worse pain than childbirth. I can honestly say, yes, the 360 lower body lift was probably worse than the pain of childbirth.
Okay, all right. So you're on that
both.
side, okay.
Yeah,
all right. Okay.
Having experienced both, I can say, for me, it was quite intense. I was pretty much bedbound for 2 weeks, low activity for about 4 weeks after that. But mentally, there were some bad days. There were some days where I really just needed my husband to sit there and let me cry and tell me it's going to be worth it. It's going to be worth it. But then once I passed that 6 week mark, it was like it had all just been a bad dream. The pain was completely gone, and I was able to start enjoying life. Second time around, not nearly so bad. Not nearly so bad at all.
The upper body.
The upper body was a breeze.
Okay.
Well, it's a good thing we started with the lower body.
Yeah. I kind of had a feeling that if we didn't do the lower body first, I would not have come back for it.
Okay. All right. Okay.
So how important would you say a good support system is getting you through these surgeries?
Integral. Absolutely integral. My mom, being a retired registered nurse, she was doing a lot of the wound care. My husband was literally having to pick me up and put me in the bed sometimes, or to help me move from room to room. It changes the family dynamic, but at the same time, I don't think I would have recovered nearly so well if I didn't have them. So a good support system is integral.
So we'll just finish up the interview by asking if you have anything to say to Dr. Katzen and vice versa.
My goodness, Dr. Katzen, I want to thank you for being the best doctor I've ever met.
Oh,
I've met quite a few of them, and
thank you very much.
I think you may have cured my white coat syndrome.
Oh, good. Good. I'm glad. I'm glad. Well, it was a pleasure helping you accomplish your weight loss goals after you lost all that weight. So it was a pleasure helping you along the way.
Thank you.
Sure. Yay.
And thank you so much, Amanda, for being here with us today, because one, you answered so many amazing questions and you gave us a lot of insight. You gave me personally insight into bariatric surgery, and it just gives me so much more respect. I already have worlds of respect for anybody who's undergone a bariatric procedure, but even more just knowing you guys had to do so much to prove yourselves. And if you're here for skin removal surgery, I know you had to do so much to get here. So really, amazing job, and you truly do deserve it. And I hope your mind fully catches up to your body, because you look amazing.
Thank you.
And you deserve to wear whatever you want. Yes.
There's been a lot of shopping. I've loved going clothes shopping. Thank you so much for giving me the opportunity to share my story.
Absolutely. Thanks for coming. So thanks for watching Plastic Surgery 90210. See you next time.